Before we get started on completing the application form, it is important to note that the service and information being provided today is based on the current information available to the public regarding the Assistance for Children with Severe Disabilities application. This information is subject to change without our notice or consent, and Surrey Place is not affiliated with any of these income support programs and do not play a role in the approval or denial of these supports. The objective today is to assist in completing the application for Assistance for Children with Severe Disabilities. Next, we will be exploring what ACSD can be used for. Assistance for Children with Severe Disabilities is a funding support offered through the Ministry of Children, Community, and Social Services. If you are a parent caring for a child with a severe disability, you may be able to receive financial support through the Assistance for Children with Severe Disabilities program. This program provides financial support for low to moderate income families to cover some of the extra costs of caring for a child who has a severe disability, an ongoing developmental or physical condition that results in a functional loss. Functional loss refers to a major loss of ability or capacity to engage in any activity commonly considered necessary and appropriate to normal daily living. Examples of this would include walking, communication, self-feeding, dressing, and personal hygiene. ACSD is a monthly supplement given to parents to assist with the extraordinary costs of having a child with a disability. The amount of funding that a family receives is largely dependent on the family's income, the size of the family, the severity of the disability, and the extraordinary costs related to the diagnosis. The monthly amount can vary anywhere from $25 to $500 per month. Below is the income cutoff chart included in the ACSD application form. On the left-hand side, you will see the family size, and on the right-hand side, you will see the correlating gross family income. There can be some exceptions to this, such as a recent job loss or a decrease in hours. You can provide your most recent EI statement or initial statement or a letter from your HR department if there have been recent changes in your job. You are also encouraged to apply if you have multiple children in the same home with a special need or a diagnosis and are over the income cutoff. Again, you will need to fill out a separate application form for each child. Depending on the income and size of the family, the program may provide anywhere from $25 to $500 a month to help with costs. These can include travel to doctor's appointments, hospitals, and other appointments related directly to the child's disability, extra clothing and shoes, extra laundry costs, parent relief such as respite, wheelchairs and other assistive devices including repairs, non-prescription medication, and dental and vision care including eyeglasses. Now we will get started on filling out the ACSD application form. Please take out your copy of your Assistance for Children with Severe Disabilities application form. At the top, you will indicate whether it is a new application or it's an annual review. They do then ask for the applicant, which is the parent or the caregiver's information. This will be the parent's name that's included on the Canada Child Benefit and likely the same parent's name that's on the Special Services at Home application form. You will also include your date of birth, your social insurance number, your health card number, and your marital status. If you have indicated a spouse, please list their last name, their social insurance number, and their date of birth. The next section is the dependent section. The first line here asks for the severely disabled child's name. This is referring to the child with a diagnosis or the disability. Please write their first and last name, their gender, their health card number, and their date of birth. Below it asks, does the child spend any time in a hospital? If this is applicable, please indicate yes here and the reason why. The other section below asks for other children that are still living at home. Please indicate their name, their sex, and their gender, and their ages. The next section now asks about your family income. Please indicate here the year of your most recent notice of assessment. Please keep in mind that as of April, the ministry will usually ask for the previous year's notice of assessment. However, in our current situation, please just send in your most recent copy, and they will notify you if they require a more up-to-date version. Towards the end of the slide, you will see a question that says, is applicant or spouse self-employed? Please indicate either yes and the nature of your occupation or no. The following question asks, does a severely disabled child have any income? Again, here please indicate either yes or no. This is usually referring to a trust fund, an annuity, or a piece of land with the child's name on it. At the top of the slide, there's a question that states, if present family income is substantially different from previous taxation year, explain, and if necessary, attach a list of the current income. Again, as stated at the beginning of the presentation, if there was a job loss or a reduction in hours, please include a copy of your most recent pay stub or a copy of your most recent EI statement or a letter from your HR department indicating the change in salary. The question below asks, has an application been made for special services at home? Please indicate either yes or no. The section below asks about specialized expenses for the disabled child. This is the information that we will be completing within the application form. So in this section, please write "See attached," and then on the right-hand side, "See attached." Please turn the page over. This slide is a declaration that all of the information written in this application is true to the best of your knowledge. You will have the parent write their name here, whose name is on the first page of the application form for ACSD. Again, that is usually the parent that is receiving the Canada Child Benefit or the parent's name who is on the Special Services at Home application form. That parent will then sign in the first signature spot below. If there was a second parent indicated or a spouse, they will then sign below, and you'll have a witness to sign both spots, as well as dating this application form here. Please turn the page over. At the top of this page, again, you will indicate the parent's name that has been written throughout this application form, and to the right, your child's name. They are now looking to explore all of your transportation and expenses to all of the medical appointments related directly to your child's diagnosis. On the left-hand side, you will see some examples of different appointments the families have gone to. For example, these could be appointments for hearing tests, visits to your family doctor or pediatrician, appointments with a speech therapist, occupational therapist, physiotherapist, behavioral therapist. This could also include any specialist appointments or neurologist appointments. For the sake of this example too, we are using all of our appointments and travel to Dr. Smith's office. On the left-hand side, the first column is looking for the doctor, hospital, or where the appointments took place. So in this case, we've indicated Dr. Smith. The column to the right is now looking at the number of visits per month or per year. If it's easier to break it down, you can simply cross off month and indicate year, and then below list the number of visits. So in this case, we have 4 visits to Dr. Smith's office throughout the year. The column on the right is now looking at method of travel. This can include use of a private car, using the TTC, or a taxi. Again, for this example, we've indicated car. The ministry is able to reimburse families 40 cents per kilometer for use of a private vehicle. We will look at this when breaking down the kilometers and the expenses. Again, the column to the right now is looking at the kilometers to and from the visit. In this case, too, for the round trip, let's say it's 15 kilometers from your house to the medical appointment at Dr. Smith's office and 15 kilometers back. This is 30 kilometers round trip. We are now going to multiply the 30 kilometers times 0.4 kilometers as the reimbursement. You will then look at the column to the right for parking costs. So for the sake of this example, again, we are now looking at $20 paid parking during each trip to Dr. Smith's office. We are now going to multiply across 4 visits per year times 30 times 0.4 for the reimbursement for kilometers plus 80 is equaling to $128 for all of our appointments at Dr. Smith's office. So you will continue to use this chart as you look at all of your appointments and all of your travel to all of these medical appointments. The section below is now referring to meal costs through the medical appointments that were mentioned above. On the left, please indicate the location of the appointments, how often you went, the cost. Also note here that the ministry is only reimbursing families up to a maximum of $8 per person for a maximum of 2 people. And then indicate the total cost. So what we will do is we will multiply across 2 times 8 times 2 equals our total cost for sick kids. So continue to do that for all of the locations listed on the left to go across. The section below now looks at extraordinary childcare and babysitting costs. So this is hiring a babysitter for children under the age of 12 years old while you're taking your child with a diagnosis to the medical appointments. Please note for any appointments during the day, the other children may be in school, so you would not need to hire a babysitter. This would be maybe for evening appointments or appointments that overlap between an after-school time period. So on the left-hand side, you will indicate the children's names, their ages, the cost per hour that you've paid a babysitter, the length of time that you're gone for the appointment, and the approximate number of visits per year. So again, we'll include the $15 times our 4 visits. The length of the visit times the 4 visits per year will equal $240. On the next page, we are now looking at personal care costs. The first box here is now looking at extra clothing. So this is the cost of additional clothing needed due to the child's diagnosis or disability. They've indicated here to list pants, tops, underwear, socks, jackets, snowsuits that may be impacted by the child with a diagnosis. So they're looking at some detail as to why these items are replaced or required. So the first example here you will see for extra tops, the reason why you're replacing them. So for example, your child's shoes on the sleeve. The shirts are $10 each and you're buying about 2 per month. So $10 times 2 per month is $20 times 12 months of the year is totaling $240 per year. The next item of clothing we're going to look at too is extra pants. So again, the reason for the replacement is lots of trips, slips, and falls resulting in damaged pants, maybe worn out knees on the pants as well. So to replace these items, they're costing about $15 each. You're replacing about 2 per month. So again, that's $30 times our 12 months is equaling $360 per year. If there are limitations too on the clothing that you do need to replace, you can also indicate that here. For example, we'll only tolerate certain materials in clothing. So what you will do is once you have broken down the cost of all of these items of clothing, you will then indicate your yearly cost to the column on the right. So in this case, we have $600. So other things you can mention in this section too, if there are sensory issues because of tags, zippers, and seams, you can indicate that here, or excessive wear or certain clothing items. For example, maybe you're going through a lot of outfits because you're doing toilet training as well. You can also indicate that in the extra clothing section. The box below now asks about other clothing costs. Okay, you'll see that here. And these are other items required due to the child's disability. So these could be bibs, bed linen, and tailoring, bed sheets, mattress pads, clothing alterations, and again, bibs. So what you want to indicate here is what you're buying. So in this case, we're looking at bed linens. Okay, this is because of frequent accidents in bed. So this is costing about $30 each, and we're replacing them about 4 times per year. So it's $120. And again, the column on your right, you will add everything up and include your total there. This section is now looking at diapers. If this slide is not applicable, please move on to the next slide. However, if your child is still in diapers, you can complete the section below. It is important to note that if your child is over 3 years old and still requires diapers, please connect with the Easter Seals Society, and they've given you the phone number there to apply for the incontinence grant. ACSD will consider the parental portion not covered by Easter Seals. So what you will do here is you'll tally up the total cost for diapers for the year, so you'll include that in the section at the top. You will then subtract the amount that Easter Seals reimburses you to put your allowable expense in the box at the bottom. You will then put this portion and this amount into the column on the right-hand side. If you are not receiving the Easter Seals Incontinence Grant, this is something you may want to look into, and you can Google it to download a copy. The next section here is now looking at laundry costs and cleaning supplies. So the ministry has indicated that the average person does about 3 loads of laundry per week. So what they want to know is, are you doing more than 3 loads of laundry per week for your child? So if you are, they want you to include the total loads per week. So here you can see we've put 6 loads of laundry per week. So that's 3 above the normal that they've suggested above. $5 times the 3 loads per week times 52 weeks of the year is $780. You can see above this line we've indicated additional loads due to spitting and accidents. In this section, they also want you to look at cleaning supplies. So below you can see here we've put additional cleaning supplies, carpet cleaner, $15 each times 4 times per year is $60. So we've taken our total cost for laundry, our total cost for cleaning supplies, and in the column on the right indicated the $840 here. In this section, you can also include any additional laundry detergent or softener that you're also purchasing to include in your total to the column on the right. The section at the bottom of the slide is now looking at shoes, boots, and orthotics. So they want to know again additional costs for shoes and or boots directly related to the child's diagnosis. So what they'll say is 4 pairs of shoes and 1 pair of boots per year is considered normal. Again, this is not because your child's feet are growing. This is directly related to their diagnosis. So this could be because they're dragging their feet. Maybe there's holes in the bottom of the sole. Maybe they throw their shoe out the window, or they chew on the side of their shoe and ruin them and you have to replace them. So the example below you can see here, we have 6 pairs of shoes per year, which is 2 above the normal they've indicated. So our shoes are costing about $30 each times 2 pairs per year is $60. So again, the column on the right, you can indicate here the total is $60. This slide now looks at the special diet. The ministry wants to know if there's a special diet related directly to your child's diagnosis that has been prescribed by a doctor or a physician. If so, there is a special diet application form that your doctor can complete. If you are receiving Ontario Works or ODSP, please talk to your ODSP or OW worker, and they will discuss their special diet application form. If your child does have other special dietary restrictions or other special diet needs, please indicate them below. This could include G-tube, Ensure, gluten-free, lactose-free, or sugar-free diet. If this is not applicable, please indicate NA to the box on your right. On the next page, we are now looking at education and social expenditures. The top box on the page is looking at special learning and development equipment related directly with the child with the disability or the diagnosis. Examples of these items could include educational toys, books, videos, tablets, apps, sensory toys, or a trampoline. The ministry will consider up to $300 per year for this section. At the top here, we've indicated educational toys, cause and effect toys, sensory materials, or tablet and apps that we've purchased for the learning and development of our child. And on the right-hand side, the yearly cost, we put the maximum of the $300 that the ministry will consider for this section. The second box on the page is now looking at special education and nursery school, which are actual costs and fees paid by the parent for specialized preschool. So again, these do have to relate to the child's diagnosis or disability, and you do have to include receipts and verification. This can also include tutoring services, a specialized daycare, or a specialized nursery school. This section is now looking at camp fees. If your child has recently attended a camp or you are planning on registering them for camp, please fill out the information below. You will include the name of the camp, the parent cost of the camp, and the start and the end dates. This section they do require verification, so you will need to provide a receipt, as mentioned here, and on the right-hand side in the column, you can indicate the total cost of the camp. If you have not yet registered your child for camp but are interested in doing so, please indicate on the section on the left, interested in registering my child for camp if funding was available. The section at the bottom of the page is now looking at social programs and recreational programs. This can include any social skills programs, after-school or weekend programs, or any memberships including a Variety Village membership. You can also include any City of Toronto recreational programs here, such as swimming, soccer, arts and crafts, or basketball, and include the total cost to the right-hand side. This section is now looking at parent relief. The cost of respite, parent relief, to allow parents time away from additional responsibilities of caring for a child with a disability. The ministry will consider up to $150 per month to pay for this respite worker. In this section, you can include the name of your worker and their phone number. If you have a respite worker that assists you in caring for your child, you can claim 100% of their wages up to $150 per month. The total on the right, $1,800, is a worker coming in for $150 per month for $1,800 for the year. If you do not yet have a respite worker, please leave this section blank and you will receive a letter from your special agreements officer stating you are eligible to receive a monthly amount once you let your special agreements officer know the name and phone number of your respite worker. In this section, please also indicate if you have a respite worker coming in less frequently. Please state their hourly wage, the number of hours per month, and the total for the year. On the next page, we are now looking at medical expenses. The box at the top is now looking at drug costs or non-prescription drugs related to a child's disability. So for example, here we've included multivitamins, which are about $10 each, times 12 purchases per year is $120 for the year. We've also included Ensure in this section as our child has difficulty eating enough nutrients for the day. Again, we're spending about $10 per week times 52 weeks is $520 for the year. In this section, you can also include allergy medication, any other vitamins that your child is taking, Tylenol, stool softeners, etc. On the right-hand column here for yearly costs, please add everything up. In this case, we've totaled $640 per the year. The box at the bottom is now looking for equipment for hearing impairment. So they do ask to include the expenses attributed to hearing impairment not covered by the Assistive Devices Program, also known as ADP, or private insurance. So it says, please do not include the costs of molds, repairs, or hearing aids, as these will be covered by the ACSD program with prior approval. If you have any questions pertaining to this section, please contact your special agreements officer prior to purchasing any hearing-related devices. If your child has a lot of sensory needs and you've also purchased noise-canceling headphones, you can also include that in this section here. And again, on the right-hand column, the yearly cost of those headphones. The next section now looks at medical and surgical supplies. The ministry asks that you specify any ongoing expenses related to the repair or maintenance of equipment related to the child's disability, including an aero chamber, bandages, gloves, G-tube supplies. If this section is not applicable, you can indicate NA to the column on your right-hand side. The box at the bottom now looks at repairs to special equipment. This refers to any ongoing expenses related to the repair or maintenance of equipment related to the child's disability. This could include repairs to walkers or braces, GoTalk, Big Mac, or any other speech devices, including the iPad. If this section is not applicable, again, the column on your right, you can indicate NA. The last section here looks at other expenses directly related to the child with a disability or diagnosis. They ask that to please list any extraordinary expenses that are incurred as a result of the child with a diagnosis. This could be the cost of repairing damaged devices or replacing them. In this case here, we've indicated replacement of a broken couch because of jumping, $400, replacement of curtains, $100, and replacement of cell phones that have been smashed and broken was $500. The column on the right, we've indicated the yearly cost as being $1,000. Additional items in this section could include painting up walls, patching up holes in the walls, and repairing any furniture. If any of this requires a larger explanation, there is a section here where you're able to elaborate a little bit more on the damages above. At the bottom of the slide here, you will indicate the date that you filled out this application again, the parent's name, again, the parent that's receiving the Canada Child Benefit, and that parent again will sign here. The next slide is now looking at the consent to disclose and verify personal information. At the top of the page, you will put the parent that you've written throughout this application form, or again, the parent that's receiving the Canada Child Benefit. If there was a spouse indicated earlier, you will also include the name of the spouse. This is consenting to the exchange of personal information between the Ministry of Children, Community and Social Services and an Ontario Works Delivery Agent, the Government of Ontario or any agency, ministry, or department of Ontario such as the Ontario Disability Support Program, or any community agency or organization or service provider that provides services to us or for our disabled child or children. This is another section where they do require the signatures. So again, the parent whose name is throughout this application form, they will sign over here at the top. And if there's a spouse, again, they will sign below. They do ask that a witness sign beside as well as date the application. The next page is the consent to recover overpayments. It is an overpayment when you receive more financial assistance than you are entitled. If you receive an overpayment, the access may be recovered through deductions at a rate of 2% of your regular monthly payment until the overpayment has been recovered. Again, they do ask in the section below for the name of the parent that's name is throughout this application form, as well as their signature and date. Below is a list of the documentation that the ministry requests when sending in the ACSD application form. They do ask for photocopies of the following documents. The first one being the medical documentation explaining your child's diagnosis or disability or functional loss. The second one is the income verification, notice of assessment for the most current tax year for you, and if applicable, your spouse. You do require verification that you receive or are eligible to receive the Canada Child Benefit on behalf of your child, a copy of your Canadian birth certificate or immigration status for your child, a Canadian birth certificate or immigration status for applicant and a spouse if applicable, the health card for your child, and a void check or direct deposit form from the bank. The next steps. Please mail the original copy of your ACSD application form to the Ministry of Children, Community and Social Services. Their address is included below is 375 University Avenue, the 5th floor, Toronto, Ontario, M7A1G1. We also ask that you keep a photocopy for yourself if you do need to complete the form again in the future. Thank you for taking the time to listen to this PowerPoint about completing your ACSD application form. Your feedback is very important to us. Please take a moment to complete this survey by taking a picture of the QR code below with your smartphone, or copy and paste the following link into your browser.